Hi, I'm Dr. Priya Patel from Pembroke Dentistry here in North Wales, PA. If you're missing a tooth or several, you might be wondering, are dental implants right for me? In this video, I'll explain what dental implants are, who they're for, and why they're considered the gold standard for tooth replacement. Let's start with the basics. What exactly is a dental implant? A dental implant is a small, screw-shaped post made from medical-grade titanium. This post is carefully placed into the jawbone where your natural tooth used to be. Think of it as a new artificial tooth root. Over the next few months, the implant actually fuses with your bone in a process called osseointegration. That fusion creates a rock-solid foundation for a crown, bridge, or even a full denture, depending on how many teeth that you're replacing. Dental implants are versatile. Whether you're missing just one tooth, several teeth in a row, or if you're struggling with a loose denture, implants can help restore both function and appearance. The best part? They look, feel, and function just like your natural teeth. Most people cannot even tell the difference. We often get asked, who is a good candidate for dental implants? The good news is that most people are great candidates. If you're missing one tooth, several teeth, or even if your teeth are in pretty bad shape due to gum disease, implants are often a great solution. We even see patients with loose or shifting teeth, and in many of those cases, implants can help restore stability and your smile. Now, there are a few exceptions. For example, we usually wait to place implants in younger patients, teens, or early 20s, because their jaws are still developing. Placing an implant too early could lead to positioning issues down the road as their bone continues to grow and shift. There are also some medical conditions we have to consider. Things like uncontrolled diabetes, heavy smoking, or a history of radiation treatment, or certain medications like bisphosphonates can affect healing. That's why we will always review your medical history carefully before recommending implants. And in the past, one of the biggest limitations was bone loss. If there wasn't enough bone in the area, implants were not an option. But now, with modern techniques like bone grafting and 3D guided implant placement, we can often work around those challenges and help more people than ever. So even if you've been told in the past that you're not a candidate, things might have changed. It's always worth coming in for a consultation. We'll walk you through your options and create a plan that fits you. In the past, if you were missing a tooth, your main options were a removable denture or a bridge. With a denture, you're putting something in and out of your mouth every day. And for a lot of people, that's just not comfortable or secure. Bridges, on the other hand, require us to shave down healthy teeth next to the gap in order to support the new tooth. That means altering perfectly good teeth, which we try to avoid if we can. Now, with dental implants, we don't need to rely on other teeth for support. We place the implant directly into the jawbone where the missing teeth was, so we can leave the surrounding teeth completely untouched. Unlike dentures, implants won't move or shift around. You can eat your favorite foods, speak without worry, and smile confidently. It just feels like you're having your natural tooth back. The process is easier than most people think. Step 1. We always start with a very comprehensive exam. If bone thickness is an issue, we will do a 3D x-ray. Doing a 3D image allows us to see the whole view of the mouth in a 3D dimension. Step 2. We will digitally plan your implant and get the correct size that works for your mouth. Step 3. The implant is placed surgically, often with just a quick numbing of the area. After healing for a few months, we will place the final crown. This is the easiest step, as we use digital scans to measure so we can avoid the yucky impressions. Most people say the healing is easier than a tooth extraction. A lot of people ask, what if I just leave the space? Do I really need to replace that missing tooth? Here's the thing. When you don't replace a missing tooth, the teeth around it can start to shift. That throws off your bite, making it harder to clean properly. And over time, it can lead to cavities and gum disease in those neighboring teeth. When you lose a tooth, the jawbone in that area starts to shrink because there's nothing there to stimulate it anymore. And over time, that can actually change the shape of your face, giving it a more sunken appearance. And unfortunately, the longer you wait, the more complex and expensive the treatment can become later on. So addressing it sooner rather than later can save you a lot, not just in cost, but in overall dental health. Does it hurt? Most people are surprised by how comfortable the implant process actually is. We numb the area really well, and many patients say it feels easier than getting a tooth pulled. For a straightforward implant, sedation isn't necessary as it will be a relatively short appointment. Afterwards, you might have some mild soreness, kind of like any other dental procedure, but it's manageable and short-lived. With today's technology and techniques, getting an implant is smoother and easier than ever. What if it's inserted wrong? One of the things that makes our implant process at Pembroke Dentistry really stand out is the technology we use. We often use a computer-generated surgical guide when placing implants. This is a custom-made guide that helps us place the implant with incredible accuracy, down to the exact angle and depth. What does that mean for you? It means the implant fits perfectly, the procedure is smoother, and there's less room for error. It also helps us avoid important structures in the jaw, making the whole process safer and more predictable. It's just one of the ways we're using technology to give you the best possible care and long-lasting results. One of the most common questions I get is how long do dental implants last? The short answer is they can last a really long time, even a lifetime, as long as they're well taken care of. Think of your implant just like a natural tooth. It still needs regular care, brushing, flossing, and coming in for your dental cleanings. The implant itself is made of titanium and is very strong, but the health of the surrounding gums and bone is what keeps everything stable. If something ever looks off or starts to shift, we can often step in early and make small repairs, just like we would with a regular tooth, before it becomes a bigger issue. So with good home care and regular checkups, your implant can stay strong and functional for decades. Are they expensive? It's true. Dental implants can seem like a bigger investment up front compared to other options. But here's what I tell patients. Implants are designed to last decades, and when you look at the long term, they often save you money. Why? Because you're avoiding future procedures like replacing bridges, adjusting dentures, or treating problems caused by shifting teeth or bone loss. And beyond just the financial part, you're saving time too. Fewer dental visits, fewer repairs, and a solution that works day in and day out. So while the cost may feel higher at first, implants really are a long-term investment in your health, your confidence, and your peace of mind. If you're ready to restore your smile and confidence, we're here to help. Book a free consultation at Pembroke Dentistry today, and let's see if implants are right for you. We'd love to help you smile again.